everyone, and welcome to another program in the Harpswell Aging at Home, affectionately known as HAH, Safety Spotlight Series. This series focuses on issues related to keeping us safe and sound in our own homes and our community. I'm Marta Frank, a Harpswell Aging at Home volunteer, and will be your guide for this program called Taking Charge of Your Healthcare. This two-part program is intended to help all of us make the best use of our visits to our medical providers, be they primary care providers, specialists, doctors, nurse practitioners, and physician's assistants, as well as whether they take place in an office, on the phone, or these days increasingly over a screen. We have all experienced feeling rushed at a visit with our care providers. So rushed, in fact, that we may forget to communicate important questions, concerns, as well as remember instructions and information that they impart to us during the visit. We hope the information in part 1 of this program will help you successfully prepare for your next visit with a medical provider so that you make the most of the time you have together. So now let's get ready for that visit. In this first of several role plays, I will play the role of the patient's friend who is helping her prepare for a visit with her nurse practitioner provider. Inez Dudley, a Harpswell resident, has graciously consented to play the role of the patient. So let's go, Inez.
Okay.
So thank you for asking me over for coffee this morning. It's really wonderful to see you. We haven't seen each other in a while.
I know, COVID has had everybody apart.
Yeah, but it's nice to be back together in person. Of course, we all have our boosters and all the shots, the requisite shots. And so I hear that you have a visit with Patsy, your nurse practitioner provider, next week.
I do, and I've got some concerns. I haven't been to a doctor physically for a while,
Right.
and I'm just not sure what I need to bring.
Right, well, good question. So first of all, you may even want to jot some notes down now, but it's a good idea to bring something that you can write on a pen, paper, to your visits, because it's so hard to remember everything that's going on.
It really is.
Yes, so do that, and then have some form of identification. They probably know who you are, and they may not ask for it, but certainly some of the visits I've had, they have asked for my ID. My insurance, your insurance cards, your Medicare card, and any other supplemental insurance, your drug card if you have a pharmacy program. So that kind of information bring with you. Oh, and I don't know if Patsy is allowing, or where she practices is allowing you to bring a friend or a relative with you, but you might be able to do that if you care, because sometimes someone with you remembers better than you do.
Do you think if I called the office, they'd let me know whether or not that's allowed?
Yes. So make that call, and sometimes they do, sometimes they don't. They were, then they aren't, so it changes. So make sure you know that, so the person doesn't show up and can't be, and they won't let them in. And bring names and phone numbers of any other providers that you've been seeing. Generally, your practitioner will have that information, but not always. So names and contact information. You don't have to have the specific phone number.
Right now, when they offered it, I signed up for my chart.
Oh,
so
good.
I have a lot of information
Yes.
that I think that they have access to
Yes.
now too, right?
You should. Sometimes they're imperfect systems. So I know when I use mine, I'll go to the provider and they'll say, oh, we never got that. And I'm like, really? I got it. So yes, but if you can do that, fine. Oh, and a medication list. You may have that, again, they should have that. They may ask you to update it when you're there. But if a medication list that says the dosage, how many times a day you take the med, and if you don't have it, you might ask your pharmacy. Sometimes they will print one out for you.
Okay, what about the over-the-counter stuff that I take?
Generally, they'll want to know that.
Even my vitamins?
Yes.
Okay.
These days, yes. There are all kinds of interactions that we don't even know about, so it's a good idea to provide all the information, more rather than less. They can just discard what they don't need.
Okay, that's wonderful.
Okay?
Thank you.
So just a little, it's almost like a little handbag that you carry with all your stuff going for your visit. I know I did that last time. It was much better. I felt prepared, and they were pleased to see that I was prepared. Sometimes you'll receive a form even to fill out before you go. these days that will update some information. Or I think Harpswell Aging at Home is working on a guide to how to prepare for a
Oh,
visit.
that would be wonderful.
Information that you can just jot down for your own self.
I always get so nervous I forget to ask questions.
I forgot to ask for refills the last time I was there. So, you know, we all do forget. And so and then this is an annual physical for you?
Yes, it is.
And you may have some questions or concerns that you want to ask your physician, or your nurse practitioner, sorry, ask Patsy. And so write those down. Prioritize what's most important for you to ask, because you know time is limited, unfortunately, and you want to be very efficient in your communications. So I know you told me, I think we spoke over the phone, you said you had, at your last visit, been diagnosed with atrial fibrillation.
I have been. And that is a concern, because I'm not sure what I'm looking for.
Right, so maybe a better description of what you should be looking for. That's a great first question. And any other prominent concerns or information that you need to ask right up front at your visit.
Wonderful.
Okay. And anything else, you know, anything. And medications that you may be on, you know, anything that you've had questions about. It's been a year, so you may have some questions. It's been a tough year for all of us.
It
so,
has.
You know, I think we all have questions and concerns these days. And you may not be able, I think medical providers try their best to give you good answers, but some things are still unknown. So you can have a good conversation, though. And then tell your provider about any changes at all in your life. Whether you've moved, whether you are now a caregiver, whether you've had a loss, whether you've been ill, whether you've had a fall, anything. So you may want to write down things that you think are pretty significant in your life, but any change.
Okay, that's really good to know.
Do you, and I'm assuming you already have a very good relationship with Patsy, so.
I do.
Good.
I do.
Good, because that'll make it easier.
It still makes me very nervous to go in, though.
Yes, yes. I'm one of those people, the first blood pressure, they have to wait for a while and
Yes.
take the second one.
Yes.
Yeah. So any other questions that you might have about the visit and getting ready for it?
You know, I think I've got, thanks to you, a pretty good idea of what I'm supposed to be doing now. What about, you know, I tripped the other day and fell. Is that something that I should mention or
Do
not?
you have any bruising, or were you sore, or does anything feel strange to you now?
No, not really.
Well, you can tell her, because is this common for you?
No.
It's unusual.
Yes.
Something on the floor that shouldn't have been?
Yes.
Okay, we all do that. Yeah, just be aware. You may want to watch the Harpswell Aging at Home fall video.
Okay.
For some updates, or, you know, just to remind you about how not, you know, what to do not to fall.
Okay.
Okay.
Super.
Okay, well, thank you. I'm so glad we've had this opportunity to have coffee together, to chat.
I'm so glad you were able to come over. That's wonderful.
Yeah, good. And I'm glad you've remained healthy this year.
Yes.
Yeah, good. So, thank you, Inez. I hope you now feel prepared, as you said you do, for your visit with your nurse practitioner provider. So let's move on to the visit itself and watch the next role play demonstrating how to communicate effectively during the visit. You want it to be an efficient and effective kind of communication. Inez will continue to play the patient, and Patsy Sear, a real-life nurse practitioner, will play the role of the medical provider and will set the scene for us.
Good morning, Inez. How are you today?
You know, I'm fine, Patsy, but it's been a really long
It
winter.
has been for all of us. So Inez, in preparation for your visit today, I know it's an annual, so we'll go over many things. I did notice that you had entered all your information on my chart. Good girl.
Thank you.
That's so helpful for me to get up to date. And I noticed that you have had your fourth shot, your second booster. How did that go?
You know, that's the only one that I really had a reaction to.
Really?
Yeah, but it was
Interesting.
only overnight, so
Perfect.
not
and so you
bad.
feel good about it today?
I
and
do,
things
very-
have
yes.
gone over. I noticed on your medication list that you had added some herbal supplements and your vitamins. Anything that has been new since we saw you last year?
Well, I started adding turmeric because that's an anti-inflammatory, I understand. And of course, as I age, it's good to get as much inflammation out as I can, I understand.
Great. So what about stuff at home as far as changes? Any big changes in your personal life? Any worries? Any new doctors you've seen that I have probably not gotten a list?
Well, I don't know about that, but I do know I fell the other day.
You did?
I did. I was real unsteady on my feet and I fell down. And that's the first time that's happened.
All right. So you and I last time discussed that you had newly been diagnosed with atrial fibrillation.
Yes.
Correct? And that we had prescribed the first line defense, which is a beta blocker, an Inderal, to help the heart rate. We can go into that a little bit more today, Ines, to make sure you understand what atrial fibrillation is. My concern about the falling, though, is the worry of atrial fib is some of the symptoms that persist, even though you've been treated for the irregular heart rate. First of all, as you know, Ines, atrial fib is very common. It's the most common arrhythmias in the aging population. It's the fact that our heart ages and no different than any other muscle. Things change electrically, so that's the change in the AFib world. But we put you on a beta blocker, which is a medication that helps control the rate. So my worry about falling, even though there is a reason to have fallen, so you think, I don't want it to be because of dizziness or the vertigo or some feeling of disorientation. So describe the fall to me.
Actually, I was just kind of walking from the kitchen into the living room, and then I was on the floor.
Okay. Early morning?
It was in the morning.
Okay. Had you just gotten up?
I'd been up a little while, but I hadn't had my coffee yet.
No coffee. I was going to say sometimes with the rapid heart rate of an atrial fib that's not controlled, you can have a little bit of disorientation and dizziness. And more so if you've had 2-3 cups of coffee, because coffee is as you know, is a caffeine, which is a stimulant. So, and had you taken your medications of the morning?
I hadn't yet.
You had not. Okay. And so, what happened when you fell? You woke up?
I was there and got up and went on with my routine and was okay after that.
Okay. And any bruises?
Just the routine ones. Nothing.
And that was
really
the only time, one time?
That is,
no difference?
Yeah.
Okay, good. So fall is, we'll put that in perspective with ongoing atrial fibrillation.
Okay.
Any other symptoms that that have changed?
No, I still get a rapid heartbeat sometimes.
You do? And describe that to me, Ines.
It flutters. It's like it's fast, but it's fluttery.
Okay. All during the day or certain parts of the day?
Most of the time it's in the late afternoon.
Late afternoon. And what does that make you do?
I might just sit down for a minute and catch my breath and
So it does make you a little short of breath?
A little bit, yeah.
Are you able to do routine exercise stuff that you've been used to doing?
I still do that, yes.
You do?
Yes.
And that doesn't affect your palpitations?
No, not often.
Okay. Do you take your pulse when that happens, when you sit down and try to catch your breath?
No.
You don't. Well, that would be a nice thing to do because sometimes atrial fibrillation comes and goes, especially if you are have not been electrically changed as far as your heart rate, called a cardioversion. We can talk about that. Ines, I just want to make sure that you know what you can do at home to make sure that your atrial fibrillation is not out of control or it doesn't continue. Because the worry about atrial fib, we can discuss atrial fib more, is the fact that sometimes the quivering atria, the first part of the heart, wants to keep up with the bottom part, and that can send you into a very fast heart rate and make you pass out. And the worry of atrial fib uncontrolled is the fact that sometimes, it leads to strokes and heart failure and stuff like that.
Oh, I didn't realize it led to strokes.
So, yes, that's one of the worrisome parts of chronic atrial fibrillation or uncontrolled atrial fibrillation.
Okay.
All right, so otherwise than that, going back to your turmeric and your other supplements, I know you don't take a lot of medications other than the beta blocker that we gave you. Or
Right.
let's call it Inderal, because that's what I.
And my vitamins.
And your
I take a
vitamins.
lot of vitamins.
Okay. And with your vitamins, are they over-the-counter vitamins? Are they from a health food store? Where do you get your vitamins?
Most of the time I get them from the health food store.
Okay, so they're pretty much been controlled and looked at and not just willy-nilly dispensed.
Correct.
Great, okay. And other than the turmeric, nothing that has been different since the last time I saw you?
No,
Okay, all right. Well, turmeric is not one that affects heart rate, it affects coagulation, so we can talk about that in a minute when we decide what to do about the atrial fib. You can stop me at any time, Inez. I know that sometimes this goes on, and I want you to be clear about your diagnosis of atrial fib, and I want you to be able to take notes. There's a lot of stuff on the web about atrial fib that sometimes you can read and say, oh my God, like the stroke worry. And that's something you and I can always come back and talk to.
I don't put a lot of faith in the web because there are so many bad sites.
You're right.
And you can't distinguish between a good site and a bad
Right.
site. Do you have a list of sites where I might go?
So I think WebMD is one of those that has been looked at by many people to make sure that the information, as opposed to Facebook or social media. The thing about WebMD is comprehensive, so not all of that pertains to you personally.
Okay.
That's the beauty of looking over and getting educated about it, and then coming back to me so we can sit down.
I was just going to say, if I looked at it and had questions, would it be okay if I called the office?
Absolutely, absolutely, Inez. We can always put in a nurse visit, or we can always put in a visit with me to go over. I can always do a telehealth. I can do a Zoom meeting, whatever, the purpose is. You need to learn to live with atrial fib. But no, the door is always open. I've known you for years, Inez. You're a smart lady. You learn, you educate yourself, and that's the beauty of being on top of your body.
Excellent. I think that's all.
Okay. So why don't we look at certain things that we should do to look at why your atrial fibrillation is persisting?
Let's set up another appointment.
Perfect. All right, thank you.
Excellent.
Good to see you.
Good to see
you
you
look good
too.
today.
Thank
Nice.
you.
Miss you.
All right.
All right, bye-bye.
We'll see you soon.
All right.
Wow, did I learn a lot from that office visit. Thank you, Patsy and Inez. We now come to the end of the first part of our program called Taking Charge of Your Healthcare. Our second part will focus on talking with our providers about a new diagnosis or even an old diagnosis, tests and their results. You heard that we're going to hopefully hear what happened to Inez when she had some of the tests that Patsy had wanted her to have. And then we're also going to talk, Patsy and Inez will talk about medications, their purpose, possible side effects, any special instructions when you take them, and then how one would get refills if necessary. Patsy and Inez will return once again to perform their helpful role plays, demonstrating how best to get the information you want and you need to take charge of your health care.
Inez, hello.
Hello again.
You're back.
I am, and I have questions.
Good, good. Well, first of all, I looked at your EKG, Inez, and it's not where I think your heart rate should be with atrial fibrillation. So let you ask the questions first, and then we can discuss a better treatment plan for you.
Okay. I'm not sure I understand fully what atrial fibrillation is.
So atrial fibrillation, again, as I said, is the most common arrhythmia or irregularity of the heart as we age. You know, when I was a baby nurse, I worked in the ICU, and many people early on had heart attacks, and heart attacks were controlled, and with all the new information on health and what we ought to do, heart attacks are not really prevalent anymore as much as atrial fibrillation because we're all aging. So for you, unfortunately, it is something that people age with, and you yourself also. So we need to find a way to look at it and learn to live with it. And some of the symptoms are also fatigue and dizziness and feeling off sorts a little bit. And let me just, I wrote them down so that you could also write them down on your list.
Okay.
But some of it is just, genetic predisposition. I have a couple patients that their father and their mother and their brother have atrial fib, so it is that. The other thing too is I'm looking at some anemia. As you get a little bit older, your blood counts are a little bit different. Anemia of aging or anemia of chronic disease. So we probably should look at a hemoglobin, hematocrit, and a CBC and make sure that you are not anemic as you get a little bit older. But the thyroid function and the anemia are two of the blood work that we should add to the fact that we've done this EKG.
Okay.
So the other thing too is that you don't smoke, so there's no pulmonary worries for me. I mean, you've not had a clot to your lung, or you've not had COPD or chronic obstructive disease, so that's not a worry for me. My worry is just controlling your heart rate and trying to decide how do we make you worry-free for the complications, which is heart failure as you get older and stroke. That's the biggest thing we worry about your age group.
Okay, and what kind of medications do you think you want me to try?
So I think before we do that, I'd like to, I looked at your EKG and you're persistent, you're fast, so we need to look at your Inderal and make sure that it's the right dose. More so though, I think we need to look at a echocardiogram, which is a ultrasound of your heart to make sure that the heart function, the pump, is not being compromised by your atrial fib. So that's something we should put in place. I was thinking that perhaps I was going to do a Holter, which is a 24-hour look at your heart, but your EKG showed me that you are in persistent atrial fibrillation. Sometimes heart rate is good, other times its heart rate is fast. So we definitely need to look at your beta blocker, your Inderal.
Okay.
The worry, Inez, is I'm sure that your atrial fib will continue. We really need to talk about thinning the blood, because the worry about atrial fib is that as the atria, or the top part of the heart, quivers, debris can take off, and it's the route is to your brain. So that's where stroke becomes a big worry.
Oh, I don't want a stroke.
Of course not. Me neither. Don't want that for you. And as your heart tries to compensate, then it becomes less efficient, called congestive heart failure. So those are the two things that we want to make sure. So I do think I want a echocardiogram to look at your heart function. So treatment for atrial fib, other than the beta blocker that I put you on, perhaps changing you to a calcium channel blocker, these two medications control the heart rate.
Now, once I start on this, do I have to take it every day? What happens if I miss a dose?
So we're talking about the anticoagulant. You're talking about the blood thinner.
Mm-hmm.
So yes, the blood thinner is something that you have to take every day at the most probably, or we want you to think about taking it around the same time because it works on a blood level.
So are you going to give me a synopsis of what we've talked about today? Because I'll never remember.
Absolutely, absolutely. So the beauty of my chart, as you know, is that we give you a summary of this visit that says, today, Inez, I talked to you about atrial fibrillation. I talked to you about setting up an echocardiogram, because any cardiologist will want to know your heart function. And that will be once I make that referral to the cardiologist, then he or she will get that test result, which is the echocardiogram.
Oh, good.
But at the end of this visit, you will get a summary that says your blood pressure today, your heart rate today, what we discussed, what I've prescribed, and the tests that I am putting in place for you.
Okay. And so if I have any questions, I can still call you.
Absolutely, Inez. I'm here to help you through this, and to help you live with this so that you are feeling good about this change in your heart pattern.
Thank you, Patsy and Inez. Boy, did I learn a lot about atrial fibrillation, medications, the functioning of the heart, tests. What a wonderful relationship we also saw between Patsy and Inez, which all of us, I think, would love to have with our medical providers. I do think that Inez really prepared for her visit, and that helped also, that she had questions and she got answers. And then there would be a summary afterwards, so Inez did not have to write a lot during the visit. She could really listen and think about the questions she wanted to ask. So wonderful demonstration of an ideal visit, I think. And I really feel prepared for my next visit now with my medical provider. And I hope everyone watching feels the same way. As we end this program, we'd like to leave you with a few summary tips. At the beginning of the visit with your provider, ask your provider what information they want from you and how much time you will have for your visit. Ask your most important questions early in the visit and be sure to ask for prescription renewals if you need them. Provide information succinctly. Stick to the point and answer questions as briefly as you can. I think we saw an excellent example of that when we viewed Patsy and Inez asking and answering questions of each other. Let your provider know if you feel rushed or not listened to. Remember, feeling uncomfortable with your provider for any reason, age, gender, the way they relate to you, might impede your ability to trust your provider and confide important information and concerns to them. Remember, you can always request a change in provider. And most of all, remember that a productive visit with your provider is an important way for you to take charge of your health care. And finally, thank you for watching this program. We hope it has provided you with helpful information, and you will watch future programs brought to you by HAH.